Hello and welcome to our class on hormones. Today we're going to talk about the hormones that are important in our evaluation of you, and they're particularly the hormones that come from the adrenal gland, the hormones that come from the ovaries and the testicles. But I want to go back just a little bit so that you can understand a little more about how this interplays with the whole body. You see, our hormone production is not unique all by itself. It is impacted by the nutrition, it's impacted by our activity, it's impacted by sleep. And when we're watching to see what happens with these different hormones, we take into account all of these other factors. Now, the hormones that we're going to be talking about today also are impacted by other hormones like the thyroid hormones, and that'll be a separate lecture. But please know that everything speaks to each other, and that, again, is important for us to be able to get to the bottom of fixing things because we have to understand all these interactions. All right. The pathway that we're going to look at today starts with one particular chemical in your body, and it's cholesterol. There it is, the one that the media has made us believe is a bad guy. And if cholesterol gets high and the number gets high and the cholesterol particles become inflamed and damaging, cholesterol can cause damage to the body. But the thing of it is, cholesterol all by itself is not a bad guy. We need cholesterol as the backbone to make a number of things. So in addition to the hormones we're about to talk about, when we're outside in the sunshine and we make vitamin D, it's because we have that cholesterol backbone that we can make the vitamin D. And there's another very important chemical that's responsible for us to be able to make energy inside of our cells. You may have heard of this. It's called CoQ10. People who are on a drug to lower their cholesterol, like a statin drug, will also not be able to make CoQ10, and that's why so many people are told now that you should be on CoQ10 if you're on a statin. Well, it's because cholesterol is responsible for other pathways that are really very important. Now let's go down the hormone pathway that we're talking about. When cholesterol is being used inside the adrenal glands, the ovaries, and the testicles to make hormones, one of the first chemicals that it'll turn into is progesterone or pregnenolone. For simplicity, I'm just going to write down progesterone here, but there's a little bit of back and forth with a few other metabolites for progesterone. And then from there, it can go down to a pathway to make another hormone called aldosterone. Aldosterone helps us to manage our blood pressure and the salts in our body. One of the biggest hormones that progesterone turns into is cortisol. Cortisol is our main stress hormone. We cannot live without cortisol. If you didn't make cortisol, the tiniest fluctuations in temperature, food, sleep and wake cycles would be so stressful for your body that you wouldn't be able to even tolerate them. So we do need cortisol, and when we're under stress, our cortisol levels go up, and that helps us to manage and navigate the stress. But here's where the problem happens. When we're under chronic, long-term, ongoing stress that we can't get away from, and that could be something like working in front of a computer screen all day long, the types of stressors that we have with the toxins we're exposed to in our environment, not sleeping well at night. When we have these chronic stressors, the cortisol levels go up, and they have a very hard time coming down because many people in our society don't get relief from those stresses. And this is when problems start to develop. High levels of cortisol over time will actually cause an inflammatory response in areas of the brain. And eventually the brain, which is the master control center for all of our hormone production, eventually the brain will say enough and shut down the signal to the adrenal glands, and then we can't make much cortisol at all. So when people are under acute stress, they get high levels of cortisol and then it comes down. When they're under chronic stress, the cortisol levels tend to be high at first, and then they gradually start going down until they're very low. And then that's when a person gets into that stage that we call burned out, where they're exhausted, they're fatigued, they can't recover from illnesses. It's very problematic. But again, it's not because they have adrenal fatigue, which is a term that you have probably heard. The adrenal glands didn't actually become fatigued. It's because the brain stops sending the signal to make the cortisol because the brain just can't handle that much cortisol. So our goal is to try to figure out where you're at in this whole cascade, pick up where you're at, and try to help you get through to some recovery. Now, cortisol is also another interesting fact about it, that it is a diurnal hormone, or it's a circadian hormone. In other words, it has times of the day where it's high and times where it's low, and this is normal. It should be like this. So if I was to draw you a graph of where your cortisol level should be during the day, when you wake up in the morning, before you wake up, they should be low because you're sleeping at night. Then they rise, and that's called the cortisol awakening response. Once light hits your eyes, the cortisol levels go up, and then they come down gradually through the day. So there's a circadian pattern to cortisol, up in the morning and then gradually coming down through the day. And once it gets low at night, you can initiate sleep with a new hormone called melatonin. Melatonin can't go up properly if your cortisol levels are too high at night. So can you think of a group of people who have a real problem with this circadian pattern? It's actually shift work people, because they're getting up when the body is trying to go to bed at night, and they're starting to work when the cortisol levels naturally should be low, but now they're forcing them to be high. And when that happens, there's those circadian patterns that occur that get disrupted. That can cause a lot of difficulty for your overall health. So the next hormones we're going to talk about are the ones that we would call sex hormones. And the first one of those hormones that is made from the progesterone is DHEA. And when we measure it, we're usually measuring the sulfated form. So if you have a lab test with this on, it'll often say DHEA-S. DHEA is a male hormone. Men and women, we all make it. It turns into other hormones, but we have receptors for it, and so it does help us with energy, it helps with mood, it helps to build muscle, but it does break down into other hormones. The first hormone it breaks down to is testosterone, and then other male hormones like androstenedione, dihydrotestosterone. So I'm just going to draw an arrow here to testosterone. Now, this other one that I mentioned to you called DHT or dihydrotestosterone, men and women both don't like it, because that's the hormone that will make the prostate large in men. It'll give us acne. It causes a male pattern hair loss. So men and women tend to not like dihydrotestosterone. And there are ways that we can sort of block that pathway so that we don't make too much of it. But testosterone also breaks down to another pathway into estrogen. This is really important for men and for women and for us, because we like to know what the estrogen levels are so that we can see if they're too high or too low and if they're balanced. In women, the balance between estrogen and progesterone is particularly important. Estrogen is a necessary hormone in our body, obviously in different amounts for men and different amounts for women. But for women, we do need estrogen. It helps with our brain power, our cognition, our mental alertness. Having estrogen helps us to fight the brain fog issue that can sometimes come during menopause. But too much estrogen without enough progesterone can be a problem. You see, estrogen causes cells to grow and multiply. It does that in the lining of the uterus, and that's why we have a cycle. It does that in the breast as well. But progesterone comes along and tells those cells to mature, not to just grow and multiply without any control. That maturation is important in the prevention of things like breast cancer or uterine cancer. And so we look for this balance, but we also see quite evidently that the balance of estrogen and progesterone helps us with things like PMS. It helps with the brain. It helps with bone structure and building bone. So that the relationship between these two is very important, and it's important through the reproductive life and after menopause. Now, how we break down the estrogen is also important. This is one of the reasons why we are so interested in knowing that your liver is doing its job well as a detoxifier organ, because the liver has to break everything down in the body. The hormones that we make, the chemicals that we eat, the antibiotics that we might take, the food that we take in, everything has to be broken down. And there's certain pathways that the estrogen is broken down. There are ways to monitor those pathways, and when it's necessary, we will do those, because we want to make sure that our patients have very healthy pathways. But let me just say this. If your body can't break the estrogen down safely, then the breakdown products of estrogen can become inflamed, by a diet that's very poor, like the North American diet. And those inflamed products will then cause damage to the DNA, and that puts you at risk for breast cancer. So again, the whole picture is important. Your liver has to break things down well. You need a diet that's full of antioxidants. You need balance of the hormones. And that's why all of this fits in together into the larger program. Now, I'm going to stop right there in talking about the hormones, and I want to go back and just plant you with another thought. When people have an elevated cholesterol, we need to think about why would it be that that cholesterol is elevated. One of the reasons why cholesterol can go up is because the body is depleted of these other hormones, and that happens under chronic stress. Can you imagine how chronic stress that drives the body to make a lot of cortisol would cause the body to become depleted of the other hormones? It makes sense now, doesn't it? Because there's only so much precursor that we can work with to make all the hormones. If our cholesterol level is high, it may be that the body is trying to make these other hormones. If your hormone levels are already low, and I put you on a medicine like a statin drug to drop your cholesterol, what's that going to do to the already low hormone levels? And because of that, that's why people who go on these medications sometimes have a much poorer quality of life, more fatigue, more problems with producing even these types of chemicals. So again, understanding what is going on is the most important thing so that we can help to correct it. When we need to use hormones for our patients, if our patients do have to go on hormones, we always use the same chemical hormone that the body makes. We call that bioidentical. And so we don't want to put you on synthetic hormones, because a synthetic hormone stuck anywhere into this pathway would obviously mess up the whole pathway. The body wouldn't do with it what it would do with your own natural hormone. Thank you.